Well, liposuction is a popular option for losing fat, but it's not right for everyone. Dr. Michael Kim joins us this morning to talk about the procedure and the questions you need to ask before deciding for yourself if it's right for you. Good morning.
Good morning.
Okay, so let's start by talking about how liposuction works.
Well, basically, it was invented probably mid-century in the 1900s to basically suck the fat out. But there was a lot of blood loss, so they invented a technique to use epinephrine and lidocaine to inject pre-liposuction, then the blood loss is minimal. And so the main important thing about liposuction is to make sure you're a good candidate. These are good candidates. You can see on the bottom, the quality of skin is good. They're not obese. They just have certain areas they're worried about. It's very safe, small areas, not a lot of fat. And you can see a pretty dramatic result from just liposuction.
Okay, and I think that there's a common misconception that only people who maybe are really obese get liposuction, but that does not look to be the case in that picture.
Correct. And in fact, obesity sometimes is really a contraindication. If someone's out of shape and fat, I tell them that they need to try to work it off naturally, diet and exercise. Once you max out on that, that's the time that you consider liposuction. And even then, if you have loose skin, weak skin, thin skin, cellulite, and you do liposuction, the results sometimes are worse than before the surgery. So it's extremely important to go to someone to get an idea of whether you're a good candidate or not. I would certainly avoid those chop block places where they say liposuction for $1,200, you know, overnight clinics, etc., because they're often not in your best interest. They're really more of a business. But you really need someone who's going to talk to you about whether you're a good candidate or not.
Okay, and we have more pictures here for good candidates. Anything else that you should do? Healthy lifestyle, good eating habits, exercise?
Correct. As you can see here, the younger patients, the chest area, the neck area, patients do very well in these areas, particularly if you're younger, not obese, working out, etc.
Okay, and let's talk about some of the risk factors with liposuction.
Well, if you have to be in good shape. Obviously, obesity we talked about, smoking, heart disease, etc. Any anesthetic problems is what we look out for. So you hear about these deaths. Usually they're liposuction obese patients who are not in good shape, long procedures, lots of fat, people who aren't good candidates. And so those are where the issues arise, usually by non-board certified plastic surgeons in some clinic somewhere on the East Coast.
Alrighty, well, Dr. Kim, thank you so much for joining us this morning. We appreciate it.